Hi everyone, this is Dr. Seeta. I'm a fertility specialist at Boon IVF and Fertility Center. So today let's know about preventing miscarriages. So can we prevent an abortion? How can we prevent it? Or what are the reasons for an abortion? Let's discuss about it. So first, there are two kinds of abortions. First is embryonic miscarriage and the second is anembryonic miscarriage. So the difference between this is very important because the reasons for embryonic and anembryonic miscarriages vary. So embryonic miscarriage is one which happens when we find an embryo on the scan. So if we find a fetal pole or if we find heartbeat and then miscarriage happens, then it is called an embryonic miscarriage. But if we don't find any embryo on scan and only on blood test we come to know that the lady is pregnant, then that kind of miscarriage is an anembryonic miscarriage. So the difference between this is important because the reasons vary. Anembryonic miscarriages mostly might be because of some genetic causes. So miscarriages can happen in natural conception and even in an IVF conception. So general miscarriage rate is around 15 to 20%, but not everybody undergo a miscarriage. So there are specific reasons for people to undergo a miscarriage. So let's discuss about the reasons why a miscarriage happens. So there can be three reasons. One is if there is a fault in the embryo. So if the embryo is not right means if it is not genetically good, then the nature tries to expel it out. So this happens in the form of a miscarriage. Second, if there is a problem in the uterus. So if there is a problem in the uterus, that means if there is any fibroid or any mass in the uterus or any infection or anything like septum or any adhesions or some uterine malformations, any problem in the uterus which can prevent the embryo to grow can also cause a miscarriage. So third is any problem in the body. So if there is any problem in the hormones like thyroid and prolactin, if there is severe hypothyroidism, or if there is uncontrolled sugars. So diabetes is also a very important cause of miscarriage because uncontrolled sugars can also cause miscarriage. If there is deficiency in the progesterone hormone levels, or most importantly, there is something called APLA, that is anti-phospholipid antibody syndrome. So if a woman is known to have APLA, if a woman is known to have that syndrome, then she is at an increased risk of miscarriage because blood gets clotted and there will be no proper blood supply to the baby. So then baby can't grow and then miscarriage happens. So if there is any of these problems in the female, then miscarriage can occur. So coming to the genetic causes. So the genetic causes in the embryo, why does a genetic problem occur in the embryo? So first is if there is any genetic problem or genetic history in the family, miscarriages can occur because of some genetic problems in the embryo. Or second, most importantly is the age. So as mother's age advances, the risk of miscarriage rate increases. So people who are 20 to 25 years have 11% risk of miscarriage, and who are 25 to 29 years have a 12% risk of miscarriage, who are almost 30 to 35 have a 15% risk of miscarriage, who are between 35 to 40 have a 25% chance of miscarriage, and who are more than 50 and who are more than 40 have almost a 50% risk of miscarriage. That means almost half of the pregnancies end up in miscarriage.